For most of the past 3 months, Singapore has kept the coronavirus under control using what experts around the world had hailed as a model program of infection control. Despite this initial success, however, Singapore failed to fully control the spread of COVID-19 and has just entered a full lockdown similar to most other countries around the world. Singapore has a subtropical, warm climate and dispels any hope that the virus might not spread once summer arrives in the Northern Hemisphere. And Singapore also provides evidence that even just a small number of cases can lead to inevitable spreading. Flattening the curve might not be enough to allow societies to exit lockdown and get back to business. The curve might need to be crushed before we can consider ourselves safe. To learn more about Singapore's experience with COVID-19 and what its government is doing to combat the virus, we spoke with Teo Yik Ying, Dean of the Medical School at the National University of Singapore. Thanks for taking the time to speak with me today. So it'd be great if you could just introduce yourself and kind of share a bit about your background and stuff like that.
Thanks for having me. My name is Yik Ying Teo. I'm the Dean for the Swee Hock School of Public Health over at the National University of Singapore. So my background, I do statistical genetics. I was trained as a mathematician at Imperial College, and then I did my PhD in statistical genetics over at the University of Oxford. I stayed in Oxford for 4 years afterwards, working for the Wellcome Trust Centre for Human Genetics, as well as at the Department of Statistics. After that, I moved back to Singapore in 2010, and I took on a position at the School of Public Health, where I specialized in the use of genetic information in public health and in clinical medicine. I look at a lot on the health services side of things, and particularly in the field of genetics, I was working in the area of malaria and tuberculosis when I was at the Wellcome Trust. So that's an introduction of myself, and I hope that's enough.
What are the latest stats and trends in the Singapore COVID-19 outbreak? Over here in the US, a lot of the headlines we see regarding Singapore indicate that it's spreading faster than it was before. And is that the case? And kind of what are the numbers officially? And then also what is the feeling regarding it maybe spreading faster than it was before?
So as of yesterday, Singapore, we have 1,375 cases in Singapore. So yesterday we added 66 new cases, which I think compared to some of the states in the United States, that number seems to be very, very trivial. But if we look at the history of over the past 3 months of Singapore's journey with COVID-19, we have been adding single-digit numbers every single day. So having two-digit numbers jump, and also just 2 days ago, we had 120 new cases jump in one single day. That seems to be very worrying. And from a modeling perspective, we actually see this as a sign that additional measures need to be put in place in the country, just because we are now dealing with different variables in the fight as compared to the early days in January, February, and the early parts of March. And we actually know why this has happened, because right now Singapore is one of the few countries that we are starting to see the second wave. The first wave was really in the early parts of January, where travelers from China actually brought the disease over to Singapore. That was our first wave. It led to community transmission. It led to some sporadic clusters in Singapore. We were able to keep that, contain those clusters fairly well, and perhaps that is why the World Health Organization thinks that Singapore has done well. Right now, we are in the phase of what I would call the second wave of the epidemic. And the second wave really came about because as countries around the world start to see outbreaks in their own regions, we have a number of Singaporeans that are based overseas. And these Singaporeans are taking the decision that they want to return to Singapore. Now, we close our borders fairly early on to all travelers. And what that means is that we don't allow non-Singaporeans or non-permanent residents to come into the country, but we still allow our own citizens to return. But a fraction of these citizens will come back already infected in their host country, and this is the result of what is driving the second wave in Singapore right now. This is actually a very important lesson to the rest of the world, because once you think that you have contained the first wave, the second wave will come from people returning or entering your country.
Let's shift topics now to the countermeasures, or the measures that different countries are using to control the spread of the disease. What measures does Singapore currently have in place to counter the spread of coronavirus?
We effectively try to do the following few things. The first is that we try to find where the cases are. And this case finding exercise is very important because it allows us to find who are the people who are likely to be infected. We isolate them early, we quarantine them early from the rest of the population. So it does two things. By finding them early, we can treat them early if indeed they are infected. And that has a much better chance that these people will not progress to more severe complications of the coronavirus infection. The second, of course, is by removing these people from the general public early, it minimizes the risk of subsequent transmission in the community. So that is very much the hallmark of what Singapore has done. The contact tracing, massive effort involving the police, involving criminal detectives coming in to monitor CCTV footages to find out which cab, which taxi individuals have got onto in order to contact trace, and then subsequently isolating and quarantining them. The second is really putting in place measures to minimize human interactions. And these measures are constantly evolving over time. So in the very early beginning, we already minimized, we banned all large gatherings of more than 250 people. In schools, we reduced class size to not more than 50 people, 50 students in class, and this gradually increased in stringency to gatherings not more than 10 people. And then now we are looking at safe distancing, physical distancing laws that requires strangers to be at least 1 meter apart from each other in public spaces. And those are the rules that are constantly trying to remind people that people lie at the heart of this outbreak. And the best way for the coronavirus to continue to spread is actually by interactions of human beings in close proximity. And this is where we're trying to get people to be personally responsible. And if that doesn't work, to put in the necessary laws to enforce people, to mandate people to be responsible enough to maintain that distancing. And this is the way that we try to put in place rules to control the spread of the coronavirus. The third response that I would say that has worked very well is actually on the communication. Because as I mentioned, the coronavirus, the situation is evolving very rapidly. All we have to do is look at some of the situation in countries outside Singapore, in European countries, even in the different states in America. You would notice that the situation evolves day by day. And that means that rules need to change, measures need to be introduced. So what Singapore has done from the very early beginning is actually to have a very systematic and consistent communication platform. Individuals can get information on WhatsApp, on their mobile phone, routinely, up to 3 times a day if they subscribe to this. And the WhatsApp channel will tell them 3 kinds of information. The first is, what is the current situation in Singapore right now in terms of the number of people who are infected, who are these people, where they're coming from, which parts of Singapore have clusters emerging. The second kind of information is really what are the personal measures that individuals can take, such as covering your hands, covering your nose and mouth when you're sneezing, and washing your hands with soap and water as regularly as possible, trying to maintain safe distancing and so on. The third kind of information that's transmitted is really around the new measures that the government has put in place, new policy, new regulations to enforce, to encourage people to stick to certain behavior, and those 3 kinds of information are transmitted. I see these 3 approaches to be very powerful, and I should emphasize that it is not just Singapore that have done well with such measures. Regions such as Hong Kong, Taiwan, South Korea, China equally adopted very similar approaches in terms of communications, very consistent from the government in terms of safe distancing, personal responsibility, and definitely contact tracing, doing a lot of testing and isolating, quarantining people that are suspected to be infected.
When reading about Singapore, it is, I read an article last week that had a picture of kindergartners with face masks on and doing hand washing lessons in their kindergarten class from like 2 or 3 years ago, way before coronavirus, because this was sort of a standard part of the mentality because of the knowledge from past experience that this type of thing can happen. I'm curious if you think that that was an important part of this, and where personal responsibility plays a role here compared to government responsibility.
You talk about societies in East Asia, and I would mention places like China, Japan, Korea, Singapore. We do have a general sense that the collective good does matter, and even if there is some curtailment of personal liberty for the sense of a collective good, actually these are the societies that will come out very well in such a crisis, because individuals know that my action doesn't just harm myself, it can also harm others. And if I take the right precautions, I protect myself, I protect my family, but more importantly, I also protect members, the strangers in the community. And that collective good mindset becomes very important when countries try to mount a response against the outbreak.
I think that in America and Western Europe and other countries outside of East Asia, there's also a sense of the public good. It's just we haven't used it very frequently in recent decades. And if you read from wartime back in World War I and II and stuff like that, I think we exhibited similar ability to collectivize our behavior and to make sacrifices.
We in Singapore, as well as regions such as Hong Kong, China, they have done well so far with the coronavirus because we have all collectively suffered from the SARS outbreak in 2003. These are countries that saw a number of infections, that saw a number of deaths, particularly amongst healthcare workers. So that is why in Singapore, a lot of effort post-SARS has been drilling hospitals, drilling doctors, nurses on infection prevention and control, such that if something of the same nature happens again, they will not be at the same level of risk as they were in during SARS. I would say SARS did catch Singapore quite unprepared at that time. But one of the things that we work very hard on is to try and not to be caught unprepared again by a similar outbreak. And this is perhaps where that level of preparation and the mindset, especially amongst the healthcare workers, has protected many of them this time around.
So one other question I have, which is sort of related to countermeasures, and it may seem silly, but I'm very intrigued by these big flamethrower, gun devices and these big fans mounted on the back of trucks that you see driving around the streets of cities in different countries around the world, misting and fogging and spraying disinfectant. And I'm curious what they're spraying, why they're spraying it, and if it serves any purpose, or is it just to make the public feel reassured that the government is doing something?
I would perhaps start from the last point that you have mentioned. Reassuring the public in some form or another is just as important as mounting an effective response. So if the purpose of the objective of doing this large-scale disinfecting of streets, of air, it's aimed at trying to reassure the public, then I say, go ahead. And I hope it works and the public is reassured. But I will come to the second part about there is a caution against that as well. That it may possess a health risk to individuals when they breathe in some of the aerosolized disinfectant. So that if it is meant to reassure the public and we see that it is working, then that is just as effective a response. But on the other hand, let's look at the science. And again, I fall back on what do we understand right now about the disease. Our understanding is that at the moment, it is not airborne. It can be aerosolized, which means if I'm coughing and I'm sneezing, and if someone is standing around me, droplets could be projected from the mouth, from the nose, such that people may breathe in that droplets and be infected. So, but you have to be in close proximity. And this is why worldwide, in Australia, in Singapore, there are recommendations on safe distancing. In Australia, it is individuals have to be one individual per 4 square meters. In Singapore, individuals have to be separated by 1 meter. In other countries, it is separation by 2 meters. That is the principle of trying to minimize spread because of this aerosolization. But if not this aerosolization, how can the coronavirus be spread? It is really through contact surfaces that if I sneeze and cough, I have viruses on my hands and I touch, whether it is desk tabletops, computer monitors, mobile phones, door handles, lift buttons, someone else comes in, touch the same surface, and subsequently, if they touch their face, this is the way that the virus can spread from one person who is infected to the surface, then to another healthy person. That means that an effective way to try and disinfect is actually to disinfect surfaces as regularly and as frequently as possible. So at the moment, I do not see that the science support the need of large-scale spraying and disinfecting of roads and of air in the way that we see some of these pictures and graphics that are coming out from some of countries. And this is where I would say we have to be very careful when we mount such a response, because firstly, it is not effective and it distracts away from what you ought to be doing, which is encouraging disinfecting of surfaces. It is distracting people from taking the personal responsibility of maintaining good personal hygiene, hand hygiene, personal responsibility when it comes to coughing and sneezing. Because people would think that, well, the government is already disinfecting the air and disinfecting surfaces, so we should be safe. And then I like to come back to the point that I mentioned briefly earlier on. Doing this aerosolization, large-scale disinfecting of air and public roads, and it comes at a cost as well. Because when you aerosolize some of this disinfectant, it could be chlorine or it could be other forms of chemicals. We don't know how, if individuals breathe in those particles or chemicals, what is the health impact? And I suspect that there will be a detrimental health impact, just that at the moment, we don't know what it is yet. But because these are likely industrial grade disinfectants, surely I do not see that it will do well for humans to be breathing them in, particularly if they are now in mist form, or even worse, there are individuals that are being disinfected with such large-scale mist like of disinfecting engines. So we have to be very careful in doing something that we need the science to justify that indeed it is going to be effective. Right now, the science still comes back to infection prevention and control, wiping down surfaces that are what we call high-touch areas, wiping them, disinfecting these high-touch areas rather than disinfecting air or roads.
That's a wonderful answer, and I really appreciate it. This is something that I've just personally, I keep seeing these photos over and over again, and I'm like, why do I see these photos in some countries and I don't see these photos in other countries? Primarily more developed nations don't use the flamethrowers and the trucks and everything. And so that led me to believe that probably a reason we're not seeing that everywhere. It probably isn't that helpful, but, of course I didn't know that. And I'm most fascinated by what you said about how doing those large scale, highly visible measures could have an adverse effect on people's feeling of personal responsibility. If they see the roads and the buildings and the doors being wiped, by the government, they may get the wrong information about how this disease spreads and how at risk they may be. I hadn't even thought about that. So that's really fascinating and a little disappointing, actually, that these governments would, potentially jeopardize their own populations by sending the wrong message, using the wrong countermeasures. Cool. Well, I really appreciate your time, and I'm so thrilled that we did this. I thought your answers were very clear and very detailed at the same time. I thank you so much, and I hope you have a good rest of your evening, and perhaps we'll talk again sometime.
Thank you very much, Bob, and have a good day. Stay
Yeah,
safe.
thank you. You too. Bye-bye.